So we were contacted by the client who wanted to evaluate the anti-diabetic effects of his formulation. We advised him that before we can go for the efficacy study, we need first to evaluate the safety of the herbal medicine before we can proceed with that, the evaluation of the efficacy.
So we embarked on evaluating this formula for its anti-diabetic properties in laboratory animals, what you would call preclinical studies. My role as a pharmacologist was to carry out evaluation of this sample, of the formula, in laboratory animals. And we used a strain of albino rats called Wister rats.
I usually prepare the drug and then use to dose the animals. I actually also induced the diabetes in the animals during the efficacy study. So after induction of the diabetes in the animals, then I gave the drug for 28 days. After the 28 days of dosing, I collected samples. We collected the blood. In the blood, we did cardiac puncture. We got the blood and took for clinical chemistry analysis. In this case, we tested for LFTs, RFTs, and then lipid profile. Then I also collected the organs, which is the liver, kidney, heart, and the pancreas. And we took for histopathology analysis. There was preparation of slides, and then we read samples under microscope, under different magnifications, and got results. And the results were exciting.
We concluded that the sample was herbal. It contained ingredients that have medicinal value.
So when we did the safety, we found the drug was actually safe up to a dose level of about 5,000 milligrams per kilogram body weight. So with that, we did the subchronic, since diabetes is a chronic condition. So some effects can be accrued as a result of continuous taking of the herbal medicine. So when we did that, our data showed that actually the plant extract was safe, had no effect on the clinical parameters, and had no effect on the liver, the pancreas, heart, and kidney of the rats. So from there, we proceeded to do the efficacy study. In the efficacy study, we now took a tenth of the LD50, which was 5,000. So we took a tenth of 5,000, which was 500 milligrams. Then to show the dose-dependent effects, we halved that dose. So we had two test groups. There was 250 milligrams per kilogram body weight, and there was 500 milligrams per kilogram body weight, along with the standard control, which was metformin, and the normal control groups.
However, there will be need to evaluate this formula further in human trials. What we have at the moment are the results obtained from laboratory animals as models. And so that is moving forward. We shall also look at the chemical compounds responsible for the management of diabetes that are contained in this herbal formula called SD 2018.
The way forward, one is to do a comprehensive phytochemical analysis, which will include identifying the compounds that could be responsible for that activity. This may be done either through a bioactive guided fractionation, where we shall fractionate the extract and see which fractions are actually responsible for the activity. Then maybe we could develop a drug lead, or to serve as a source of a new anti-diabetic drug, which may be actually oral in nature.